अस्सलाम वालेकुम डियर स्टूडेंट्स, क्या हाल चाल है आपका। आज हम पढ़ेंगे ट्यूमर मार्कर्स के बारे में। व्हाट आर ट्यूमर मार्कर्स? ट्यूमर मार्कर्स आर सब्सटेंसेस दैट कैन बी फाउंड इन द बॉडी व्हेन कैंसर इज़ प्रेजेंट। ट्यूमर मार्कर हमें तब पता चलेगा, वो सब्सटेंसेस है दैट कैन बी फाउंड तब सामने आती है जब कैंसर इज़ प्रेजेंट, जब किसी किस्म का एबनॉर्मेलिटी होती है। दे आर यूजुअली फाउंड इन द ब्लड और यूरिन। ये आमतौर पर ब्लड और यूरिन के अंदर पाए जाते हैं। दे कैन बी प्रोडक्ट ऑफ कैंसर सेल्स of our body is response to cancer. Most tumor marker are proteins. most ज़्यादातर ट्यूमर्स प्रोटीन होते हैं for many reasons. Tumor marker itself is usually not enough to diagnose or rule out cancer. Most tumor marker can also be made by normal cell as well as by cancer cell. Sometimes non-cancerous condition can also cause elevation of some tumor marker to be higher than normal. Besides, not every cancer patient may have raised level of a tumor marker. For these reasons, only a handful of tumor marker are commonly used by most doctors. How are tumor markers used? For screening and early detection of cancer. Screening refer to looking for cancer in people who have no symptom of disease, while early detection is finding cancer to on early stage. Although tumor marker were first developed to test for cancer in people without symptom, very few tumor markers have been found to be helpful in this way because most tumor markers have not been shown to detect cancer much earlier than they would have been found otherwise. Diagnosing cancer. In most cases, cancer can also be diagnosed by a biopsy, and tumor markers are usually not be used to diagnose cancer. However, tumor marker can also determine if cancer is likely in some patient. It can also help diagnose the origin of cancer in patients presenting with advanced widespread disease. Determining the prognosis outlook for certain cancer. Some newer tumor marker help to assess how aggressive a cancer is likely to be, even how well it might respond to cancer drug. Determining the effectiveness of cancer treatment. One of the most important uses of tumor marker to monitor patient being treated for cancer. If the initially raised tumor marker level goes down with treatment, it indicates that the treatment is working and having a beneficial effect. On the other hand, if the marker level goes up, then the treatment is probably not working and change of treatment should be considered. Detection recurrent cancer. Markers are also used to detect cancer that recur after initial treatment. Some tumor marker can also be helpful once treatment has been completed or with no evidence of residual cancer left. These include prostate specific antigen for prostate cancer, HCG for gestational or trophoblastic tumor, and germ cell tumor of ovaries and testes, and CA125 for epithelial ovarian cancer. Tumor marker in use. Tumor marker alpha-fetoprotein. Alpha-fetoprotein is elevated in hepatocellular carcinoma of liver and useful for monitoring response to treatment. AFP is elevated hepatocellular carcinoma. Hepatocellular carcinoma are present in the liver. ये हमें जिगर के हेपेटोसेलुलर जिगर के सेल्स होते हैं, ये जिगर के कैंसर के बारे में इंडिकेट देते हैं. AFP इज़ आल्सो एलिवेटेड इन सर्टेन टेस्टिकुलर कैंसर. AFP जो होता है ये हमें उस भी कंडीशन में नज़र आता है जब टेस्टिकुलर कैंसर होता है. एम्ब्रियोनल सेल एंड एंडोडर्मल सिनेस्टॉइड. एलिवेशन इन मल्टीपल मायोलोमा, chronic lymphocytic leukemia and some lymphomas. Beta-2 microglobulin B2M is also known as beta-2 microglobulin. Patient with higher level of B2M usually have a worse prognosis. अगर एक पेशेंट को B2M का लेवल बहुत ज़्यादा बढ़ा हो तो उसे वर्स प्रोग्नोसिस है, उसे हाई किस्म के एक डिजीज़ है. Beta-2 microglobulin is often elevated in chronic renal failure and diagnosed patient without cancer. Beta-2 माइक्रोग्लोबुलिन है जो एलिवेटेड करता है क्रोनिक रीनल फेलियर, मज़ीद बढ़ी हुई गुर्दों की बीमारी के बारे में, और डायलिसिस पेशेंट, जो पेशेंट आखिरी स्टेज पे होते हैं रीनल फेलियर में विदाउट कैंसर. Bladder tumor antigen BTA. BTA is found in urine of many bladder cancer patients. Test results are response as ATR positive, BTA present or negative, BTA not present. It can be used together with NMP22C below to detect recurrent tumor. The test is not widely used and it is still being studied. It is not certain whether it is sensitive as cystoscopy for diagnosis or follow-up. CA153 CA15x3 can be used to monitor breast cancer patient. CA15.3 is also known as can be used to monitor breast cancer. आमतौर पर ये ब्रेस्ट कैंसर के लिए इंडिकेट किया जाता है. एलिवेशन ब्लड लेवल आर फाउंड इन लेस देन 10%. एलिवेटेड ब्लड लेवल आर फाउंड इन 10% से कम होती वैल्यू ऑफ पेशेंट विद अर्ली डिजीज एंड अबाउट 70% पेशेंट विद एडवांस डिजीज. CA15.3 लेवल यूजुअली ड्रॉप फॉलोइंग इफेक्टिव ट्रीटमेंट. इसका लेवल इन डिजीज़ में बढ़ जाता है या फिर ये असरअंदाज होता है. बट CA15.3 कैन आल्सो बी एलिवेटेड इन अदर कैंसर एंड सम नॉन कैंसियस कंडीशन सच एज बीइंग नाइन ब्रेस्ट कंडीशन एंड हेपेटाइटिस. और ये हेपेटाइटिस में और B9 ब्रेस्ट कैंसर में भी इंडिकेट किया जा सकता है. CA27.29 is another marker to monitor breast cancer patient. CA125. The test measures the same marker as CA15.3 but in different way to does not appear to be any better in detection early in advanced disease. It can also be raised in other cancer and some non-cancerous condition. CA125 is standard tumor marker to following patient with epithelial ovarian cancer during and after treatment. Less than 90% of patients with advanced ovarian cancer have elevated CA125. Because about half of ovarian cancer patients with elevated CA125 still have tumor confined to the ovary. CA125 is being studied as screening test for ovarian cancer. See next section of detail. CA125 can also be raised in patients with endometrial and pancreatic cancer as well as in benign conditions such as endometriosis, pelvic inflammation, matrix disease and benign ovarian cyst.